Hello, Nurse Know-How community. Today, we're digging into the emergency medications you'll often find in hospital crash carts and shed light on the uses of these life-saving drugs. Let's dive in. Adenosine, used to diagnose and treat supraventricular tachycardia, which is a rapid heart rate that originates from the upper chambers of the heart. Adenosine slows down the electrical impulses in the heart and restores a normal rhythm. Adrenaline, used in cardiac arrest, bronchospasm, and emergency treatment of allergic reactions, including anaphylaxis. Adrenaline increases the heart rate, blood pressure, and oxygen delivery to the tissues. It also relaxes the smooth muscles in the lungs and reduces the swelling and inflammation caused by allergic reactions. Amiodarone, used to treat ventricular fibrillation and pulseless ventricular tachycardia, which are life-threatening irregular heart rhythms that prevent the heart from pumping blood effectively. Amiodarone works by blocking the sodium, potassium, and calcium channels in the heart cells, and prolonging the refractory period of the cardiac action potential. This stabilizes the heart rhythm and prevents further arrhythmias. Aminophylline, used to treat acute asthma attacks and chronic obstructive pulmonary disease, COPD. Aminophylline relaxes the smooth muscles in the airways and increases the airflow to the lungs. It also has anti-inflammatory and diuretic effects. Atropine, used in AV heart block, to restore cardiac rate, and to reduce respiratory secretions. Atropine blocks the parasympathetic nervous system and increases the heart rate and conduction. It also inhibits the secretion of saliva, mucus, and other fluids. Calcium gluconate, used to treat hypocalcemia, low calcium levels, hyperkalemia, high potassium levels, and calcium channel blocker toxicity. Calcium gluconate replenishes the calcium levels in the blood and counteracts the effects of potassium and calcium channel blockers on the heart. Dexamethasone, used to treat severe allergic reactions, inflammation, and cerebral edema. Dexamethasone is a corticosteroid that suppresses the immune system and reduces the production of inflammatory mediators. It also decreases the swelling and pressure in the brain. Diazepam, used to treat seizures, anxiety, and alcohol withdrawal. Diazepam is a benzodiazepine that enhances the effects of a neurotransmitter called gamma-aminobutyric acid, GABA, which inhibits the activity of the nervous system. This produces a calming and anticonvulsant effect. Digoxin, used to treat heart failure and atrial fibrillation. Digoxin is a cardiac glycoside that increases the force and efficiency of the heart contractions, and slows down the heart rate. It also regulates the electrical activity of the heart and prevents irregular rhythms. Dobutamine, used to treat cardiogenic shock and heart failure. Dobutamine is a sympathomimic agent that stimulates the beta-1 receptors in the heart, which increases the contractility, stroke volume, and cardiac output of the heart. It also dilates the blood vessels and reduces the afterload on the heart. Dopamine, used to treat hypotension, shock, and low cardiac output. Dopamine is a sympathomimetic agent that stimulates the alpha, beta, and dopamine receptors in the body, which increases the blood pressure, heart rate, and cardiac output. It also improves the blood flow to the kidneys and other vital organs. Ethamsylate, used to treat bleeding disorders and hemorrhage. Ethamsylate is a hemostatic agent that strengthens the capillary walls and reduces the capillary permeability. It also activates the platelets and the clotting factors, which promotes the formation of blood clots. Flumazenil, used to reverse the effects of benzodiazepines, such as diazepam. Flumazenil is a benzodiazepine antagonist that blocks the action of benzodiazepines on the GABA receptors, which restores the normal activity of the nervous system. Heparin, used to prevent and treat blood clots. Heparin is an anticoagulant that inhibits the formation of thrombin, which is an enzyme that converts fibrinogen into fibrin, the main component of blood clots. Heparin also activates antithrombin, which is a protein that inactivates other clotting factors. Hydrocortisone, used to treat severe allergic reactions, inflammation, and adrenal insufficiency. Hydrocortisone is a corticosteroid that mimics the effects of cortisol, a hormone produced by the adrenal glands. Hydrocortisone suppresses the immune system and reduces the production of inflammatory mediators. It also regulates the metabolism, blood pressure, and stress response of the body. Lasix, used to treat fluid overload, edema, and hypertension. Lasix is a diuretic that inhibits the reabsorption of sodium and water in the kidneys, which increases the urine output and reduces the fluid volume and blood pressure in the body. Lidocaine, used to treat ventricular tachycardia and ventricular fibrillation, which are life-threatening irregular heart rhythms that prevent the heart from pumping blood effectively. Lidocaine is an antiarrhythmic drug that blocks the sodium channels in the heart cells, which reduces the excitability and conduction of the heart. This stabilizes the heart rhythm and prevents further arrhythmias. Mephentermine, used to treat hypotension and shock. Mephentermine is a sympathomimetic agent that stimulates the alpha and beta receptors in the body, which increases the blood pressure, heart rate, and cardiac output. It also constricts the blood vessels and increases the peripheral resistance. Methylprednisolone, used to treat severe allergic reactions, inflammation, and spinal cord injury. Methylprednisolone is a corticosteroid that suppresses the immune system and reduces the production of inflammatory mediators. It also decreases the swelling and pressure in the spinal cord. Midazolam, used to induce sedation, amnesia, and anesthesia. Midaz is a benzodiazepine that enhances the effects of GABA, which inhibits the activity of the nervous system. This produces a relaxing, hypnotic, and anesthetic effect. Naloxone, used to reverse the effects of opioids, such as morphine. Naloxone is an opioid antagonist that blocks the action of opioids on the opioid receptors, which restores the normal activity of the nervous system and the respiratory system. Nitroglycerin, used to treat angina, myocardial infarction, and pulmonary edema. Nitroglycerin is a vasodilator that relaxes the smooth muscles in the blood vessels, especially the coronary arteries. This increases the blood flow to the heart and reduces the workload and oxygen demand of the heart. Noradrenaline, used to treat hypotension, shock, and low cardiac output. Noradrenaline is a sympathomimetic agent that stimulates the alpha and beta receptors in the body, which increases the blood pressure, heart rate, and cardiac output. It also constricts the blood vessels and increases the peripheral resistance. Paracetamol, used to treat pain and fever. Paracetamol is an analgesic and antipyretic that inhibits the synthesis of prostaglandins, which are chemicals that mediate pain and inflammation. It also acts on the hypothalamus to reduce the body temperature. Phenergan, used to treat allergic reactions, motion sickness, and nausea. Phenergan is an antihistamine that blocks the effects of histamine, a chemical released during allergic reactions. It also has antiemetic and sedative properties. Potassium chloride, used to treat hypokalemia, low potassium levels. Potassium chloride replenishes the potassium levels in the blood and maintains the normal function of the nerves, muscles, and heart. Sodium bicarbonate, used to treat metabolic acidosis, cardiac arrest, and drug overdose. Sodium bicarbonate is a buffer that neutralizes the excess acid in the blood and raises the pH. It also enhances the elimination of some drugs by increasing the urine alkalinity. Succinylcholine, used to induce muscle relaxation and paralysis for intubation and ventilation. Succinylcholine is a neuromuscular blocker that mimics the action of acetylcholine and depolarizes the muscle cells. This prevents the transmission of nerve impulses to the muscles and causes flaccid paralysis. Vasopressin, used to treat cardiac arrest, septic shock, and diabetes insipidus. Vasopressin is a hormone that stimulates the V1 and V2 receptors in the body, which increases the blood pressure, vasoconstriction, and water reabsorption in the kidneys. 25% dextrose, used to treat hypoglycemia, low blood sugar. 25% dextrose is a concentrated glucose solution that raises the blood sugar level and provides energy to the cells. That wraps up our exploration of essential emergency medications found in hospital crash carts. Remember, the use of these medications requires careful assessment by healthcare professionals. If you found this information valuable, don't forget to like, share, and subscribe for more medical insights. Until next time, stay informed and stay healthy.